so now I will demonstrate you how to use LymphaTouch post-operatively. Here we have the case who have had an ACL surgery just 3 weeks ago, and this same procedure can be conducted even on second post-operative day. So what we have done already, we activated the ducts from the supraclavicular fossa area with the stationary technique, basically to activate the lymphatic system in the beginning, and we have already activated the lymph nodes from the inguinal area, and now I will show you the local treatment of the fresh scar. Post-operatively, we use usually the negative pressure amount of between 50 and 100 millimeters of mercury. So basically, we don't need a lot of negative pressure because we are working with very superficial layers of the tissue when we are activating the lymphatics, and we want to remove the metabolic waste away from the operation site. Okay, so I will start now activating the lymphatics from the thigh area with the stationary technique. First, from proximal to distal direction. Now I have 80 millimeters of mercury of negative pressure because we have the patient who has received already several treatments of LymphaTouch treatments, but with very acute phase or very post-operatively. For example, when you're doing the treatment on second post-operative day, you should probably start with lower negative pressure in the beginning, like 50 millimeters of mercury or something like that. Okay, so now we have activated the lymphatics from the proximal part to the distal direction. So now I will show you how to activate this operation site with the LymphaTouch treatment. So we don't go directly on top of the scar itself because it's too soon. It's only 3 weeks old scar. So we don't want to disturb the healing process. We want to enhance the healing process and support it by activating the metabolism. So we will just treat with stationary technique around the operation site. We can also apply some vibration. I would start with higher frequencies in the beginning. So that might also help to remove the metabolic waste from the operation site. So usually when we have the case like this, when they have had a surgery around the knee area, it's very common that you still have swelling in distal parts. So we also want to help that swelling. So usually we work, of course, around the operation site to activate the metabolism in that site, but we also want to reduce the swelling. So we also activate the lymphatics from the knee towards the ankle area with the stationary technique again. All the way down to the ankle. 3 to 5 pulsations in one spot and then to the next spot. This is also the protocol that we would use if we want to treat, for example, ankle sprain or any other types of injuries in distal parts of the foot. So we would activate all the way, and then we would use the sliding technique towards the knee and all the way to the inguinal lymph nodes to move the fluid. In this case, I would use the pulsative negative pressure because it's post-operative, so the continuous negative pressure might be a little bit too intense, but you can also use continuous negative pressure when you are doing the sliding technique. And you can also apply some lotion or oil to help the sliding. So now we always end the treatment with the sliding technique, and I would do this same type of treatment many times to move the fluid back to proximal parts.